This is a wonderful information. Thank you for sharing, and so great to learn from your wisdom and knowledge about this area. So looks like, just want to summarize for our colleagues out there who are listening. PSMA-based scans are going to be universally available. Multiple tracers are going to be approved or are already approved. They're endorsed by guidelines, and they're covered by Medicare and in turn insurance carriers. So it looks like it is a matter of time. We are talking about months, if not years, or rather we are talking about maybe a year before these scans are widely available. How do you think the cost is going to be impacting the use of PSMA-PET scan, PSMA-based scan in our practices? This is the last question for you, Jeremy.
Okay.
Do you see any cost issues with this?
So this will take some time, I think, to be able to really answer to that questions. First of all, you need to have the final commercial cost, which we don't know yet, because many of these compounds owned by industry, their rates are not finally set up. Some costs will differ from different insurances reimbursement and also from an hospital to another. So that's one first thing. Then it's not always easy to assess what is really cost effectiveness if you talk in terms of just the procedure costs only, or all the implications down the road that performing this scan implies to the patient care in terms of treatment indications, in terms of monitoring, in terms of treatment, patient staging. You put patient in different categories, you order different treatment at the end, and it's not straightforward to assess how this turn out into better cost effectiveness. The ProPSMA study, just as mentioned by Dr. Tward before, they ran a subsequent analysis post hoc on the cost effectiveness in that exact setting. And we also run another study here at UCLA looking at the salvage radiation setting, putting many data coming from all the big trials, making assumptions, what would have happened without the scan or with the scan, and trying to see all the treatments down the road that the patient would have with their different life expectancy and progression time-free survival. And then this was led by our radiation oncologists here at UCLA. And at the end, PSMA-PET scan was able to save more than 15 to 20K per patient overall. Of course, there is a lot of things you can discuss about the methodology about that, but
yes, absolutely, yeah.
It goes in the way that usually, if you have a more accurate test, you are supposed to treat better the patients, so they live longer in a healthier manner, and you can also better direct adapted treatment with less failure. It is supposed to be more cost effective.
So based on the prelim studies, smaller studies, it seems to be cost effective. Looks like, which is great, but time will tell how insurance companies are going to be estimating the cost and how easy it will be to get reimbursement for the PSMA-based scans. Having said that, I think this is all exciting news for our patients, that they will have a much better imaging modality when they are being diagnosed with prostate cancer, or they are being failed by earlier therapies and being considered for salvage radiation therapy, or when they are being considered for treatment for their metastatic prostate cancer. I think PSMA imaging looks like is going to be playing a role in across the spectrum of prostate cancer treatment and management, and starting with the diagnosis.